and we know Lashma is Lagos State Health Management Agency. And what you can see today is a product of effort of the executive of ACPAN Lagos. Recently we were in the office of Lagos State Health Management Office, and we had beautiful outing. And the best thing is for us to bring it to the table and to bring it for our members to be able to tap from what we have been able to the effort we've been able to make during the visit. Today, we're going to have that engagement with the authority of the agency. They have the doctor that has been given the guest speaker will be willing to tell us all we're supposed to know today. And for that reason, I welcome you all. Just be attentive. We're going to have a lot to gain. It's quality framework towards achieving universal health coverage. And at the end of it, all of us will be able to beat our chests for picking one thing or the other from this engagement. Thank you, and I'm welcoming you once again on board. Thank you very much. I don't know whether the chairman is now with us. If she's with us, I would have loved to call her for her opening remark.
I think she's having a network problem.
Is having, maybe we'll just move a little so that when she comes, we'll be able to recognize her to give her opening remark. Mrs. Aladesomi, are you on board?
Yes, I'm here.
Yes, if you are here, please, let's go. That voice, the ACPAN voice over the intro, can we have it so that we can go from there? But I want you to alert me when the chairman of the ACPAN Lagos is out. Over to you.
Having disruption, people are trying to call me, but I'll just go ahead and just say what we have to say. Good morning, everyone. Thank you so much for joining us. My name is Pharmacist Aladesomi. I'm the Publicity Secretary, Healthcare Providers Association of Nigeria, Lagos State Chapter. So very briefly, for those of us that are new to HCPAN, HCPAN stands for Association of Healthcare Providers. It's Healthcare Providers Association of Nigeria. It was formed in 2004 in compliance with Decree 35 of 1999. Our mission is to be the mouthpiece of all healthcare providers in managed care in the nation. And our vision is to have a healthy Nigeria encompassing society, community, and the common man at grassroots. Our focus is on the National Health Insurance Scheme that is now the National Health Insurance Authority, NHIA. And HCPAN membership includes all professionals who have facilities registered by relevant regulatory bodies. So our membership includes private medical practitioners, specialist doctors, dental practitioners, pharmacists, nurses and midwives, medical laboratory scientists, physiotherapists, radiographers, optometrists, and ophthalmologists, and also nutritionists. So as an association, we aim at contributing to improving the health outcomes of the nation by maintaining a high standard of healthcare delivery and providing quality care for the enrollees at affordable cost. The association ensures continuing education of providers through capacity building, workshops, and training on the varied operations of managed care, like we're doing today. Registration of our members and payment of annual dues for this year is pegged at 5,000. And how do you register? Very simple. Go to the HCPAN Lagos website, which is www.hcpanlagos.org. Click on the membership registration on the top left-hand corner. fill the registration form and submit. And also would like that you make your payments to Hitsipan Lagos chapter Zenith Bank account 101-318-7791. I'll take that again, Zenith Bank account 101-318-7791. And all payments receipts are to be sent to our email address, which is the admin@hitsipanlagos.org. You wait for the verification of payments and confirmation. You will receive a confirmatory email within a short space of time. If you have other inquiries or you have challenges with registration or payment, kindly contact the Financial Secretary, Hitsipan Lagos, MLS Olumide Fadikwe. His phone number is 080-333-52235. Thank you. If you registered for this webinar, we'll send these very details to you by mail. Thank you so much and welcome once again to this webinar.
Thank you, ma'am. I appreciate that. That's a beautiful one. And for those who are joining us, please take note of this. Take note of this information so that you can strengthen Hitsipan Lagos. Thank you once again. The next thing on the agenda, I don't know whether the chairman is. The chairman, are you with us now? Hello, ma'am. If she's not, then we need to move to the next. Hello?
Hello.
Okay, we can see you have issue with your network. Hello? Okay. Pending the time she is going to sort out her network, I think we should just allow the program to go on. Now, I want the next thing on the agenda will be. Hello? Hello, ma.
I think we have the receipt number for it. We can take over. I will hand over to MLS. This is the operator for the vision for the webinar.
We are not hearing you well, ma. Can the house here have very well? Hello?
It's not clear yet. I think we can move on until when it's sorted. You can go to the next agenda. Yes, go ahead.
The next on the
Maybe
agenda.
Yes.
Yes, the next thing on the agenda is a New Heights farmer presentation. The farmer, New Heights farmer, the representative, are we here? If you are here, can you just be recognized? The New Heights farmer.
Yes, I am. Yes, I am. Good morning, everyone.
Yes, you are welcome.
All protocol duly observed. Thank you very much.
Thank you. So if you are set
Hello,
for
sir.
your presentation.
Yes.
Hello, are you set for the presentation, please?
Yes, I am. I only share a message now on the webinar chat room. The screen, share screen feature is not enabled for me to be able to share my screen for the presentation. But I can actually go ahead, yes.
The people on our technical crew should help us. Even the video too was not enabled. Please, the technical crew should help us to get this technical problem resolved, please. So pending that, sir.
So we're on it.
Okay. We are pending that moment. Can you can help us just introduce your company? Let's have
okay. Thank you very much, sir. Thank you very much once again. I want to say thank you to the executive of Hitsipan Lagos for allowing us to be part of this. My name is Olayinka Ebenezer, and I'm the General Manager for Business Strategy of New Height Pharmaceuticals. New Height Pharmaceuticals is actually the official business partner for Omron Healthcare in Nigeria. So we promote Omron product ranges from the blood pressure monitors, nebulizers, scales, and other things. Even though outside the Omron blood pressure monitors, New Height Pharma was also a major pharma wholesaler in Lagos, in Nigeria actually, but we are based in Lagos more. So for all the medical doctors around, pharmacists, and every other healthcare professionals, we can actually be of support in providing all your medication in one stop. So that is a bit introduction about New Height Pharma. Hope you can hear me all, please, just to be sure.
Yeah, we can hear you. We can hear you.
Great. Thank you very much, sir.
God bless you.
Okay. So that is that. Now, for the presentation today is actually in line with the World Hypertension Day. Actually, we are still in the whole month of May. This month of May is recognized as the May Measurement Month, where the awareness about hypertension is being carried out, enabled. Everybody is expected to join first to talk about hypertension issues in Nigeria. Now, the theme for this month, or this year especially, says measure accurately. And that is exactly what brought us to this table. That as of today, first, the awareness of hypertension is increasing, even in Nigeria, even though compared to developed countries, we are still very low. But even in Nigeria as of today, based on the work that has been done by every wonderful people in this house this morning, there's a form of awareness in our country. But now, the message has moved away from just being aware. There is now a need for us to ensure that people are measuring accurately. Now, in my slide, one of the things I put there is the fact that each 2 millimeter mercury rise in systolic blood pressure is a risk factor. It can cause like 7% of heart disease and 10% of stroke, just a 2 millimeter mercury rise. So it is not just enough for people to check blood pressure. We are past that level now. People know about blood pressure issues. People know everybody loves to check. But now we need to ensure that the results people are getting, the results our patients are bringing to us, the results that we are also providing for their patients are accurate results. It is not just anyhow result. It has to be accurate results. Now, and when we talk about accuracy, one major thing that strikes out is clinical validation. It is not enough for anybody to buy a blood pressure machine. It's not enough for an institution to use a blood pressure machine. Apart from, we all know that the mercury speak is actually the gold standard, but time will not permit me to come back to tell us some of the issues with the mercury speak. But this era that we are promoting self-measurement of blood pressure and all that, it is also very important that people don't just pick up any device on the shelf anywhere and begin to use it to check their blood pressure. Blood pressure monitor that is allowed, that is expected for people to use, must be a clinical validated blood pressure monitor, because the issue of accuracy from our own point of view, the issue of accuracy, which is a very pivotal issue in measurement of hypertension and its consequences, the stroke, heart disease, and all that, stand on two major pillars for us. As Omron Healthcare, we believe that accuracy stands on two major pillars. Number one is the device issue itself, device-related issues, and the cough-related issues. Over the years, we've always been telling people about, the procedures of checking blood pressure, ensure that you rest, you do this, you do that. Very good. Most people now are used to that. They know when to check. They know they need to rest well before they check. But accuracy now has to stay on the issue of the device itself. Now, on the device itself, like I said, it is not enough for us to just pick up any old device to check our blood pressure. It is important that people use clinically validated devices. People must use clinically validated devices for their blood pressure. And that is exactly what we are preaching at the moment. It is not just any old device, it has to be a clinically validated device. Now, when we're talking about clinical validation is not what is done by the roadside. The mercury sphere, like I said, is actually the gold standard. Now, any other device must be able to measure up with the mercury sphere. Now, when we look at mercury sphere, when we talk about the issue of clinical validation, I'm trying to combine that with just my slide that is not showing, making me to go in and out. This validation is not just a claim. It is not just a claim to ensure accuracy. It is a process. It is a procedure that have been established by European Society of Hypertension, Advanced Automation, British Hypertension Society, a team of professionals coming together to ensure that the result that is coming out of these devices are validated, can be used for clinical interpretation. And as of today, I can tell you all Omron blood pressure devices are validated to plus or minus 4 against the gold standard. That is the gold standard of mercury. Now, like I said earlier, usage of mercury sphere in our institution have actually been restricted. WHO and every other regulatory body have been saying that mercury-contained devices should not be used in our institutions again. I know we are all coming towards that generation, but that's still the gold standard. So the result that people are getting when we talk about validation, it gives our customers peace of mind that they are not just getting the blood pressure result, but they are getting a result that the physicians can use. They are getting the results that can be used for the management of their health. And this is actually the message that even WHO, ISN is bringing to the people this year. It is not just enough to check blood pressure. It has to be checked and the result has to be accurate. And for it to be accurate, the first basis where we need to start with is clinical validation. So, and like I said, for Omron blood pressure monitor, it is plus or minus 4 compared to a mercury sphere that is properly used by a professional. Because most people don't even know that a mercury sphere is supposed to be recalibrated every year. You're supposed to recalibrate your mercury sphere. We're not even sure of the one we get in our market. So that is the first rule for validation. Now, the second thing is that healthcare professionals are also very worried because the truth is that you have to be sure that you are managing your patients with accurate results, because every result you are getting have an implication on your next management. Now, but the next thing that we discovered after the issue of clinical validation is the issue of the curves. Most times when it comes to own blood pressure monitoring that we are pushing, we sometimes forget that it is end users. I don't want to use the common word, they call them laymen, of these people that are not science inclined, people that are not pharmacists, they are not doctors, they are not science inclined anyway. The old woman in the village that is going to be using these blood pressure monitors at home. Meaning, the way we always tell them, place your cuff here, make sure that the tube is at the center of your hand, is above your elbow. Some of these technicalities is not convenient for them. And as a result of that, we discovered that cuff usage is also a major source of inaccuracy. For example, Omron blood pressure monitors have two major cuff sizes. We have the 22 to 32 centimeter, which is for standard adults, and we have the 22 to 42 centimeter for people that their arm is bigger. Now, a lot of people ignore this. I've had a lot of customers tell us, or professionals tell us, oh, why don't you have a cuff, one cuff for everybody? It doesn't work like that. If you use a big cuff of maybe 42 centimeter for somebody that the arm is barely, the arm circumference is barely 18 or 19. That means you have to wrap the cuff over and over. Some of this, anytime we do things like this, you are not going to get an accurate result because you have overlapped the cuff over and over. That might give the person a lower reading. Or I've seen in cases where some people will buy a device, any device with a standard cuff, and they will get somebody with a larger arm. They will now use hand to hold the end of the cuff for it not to open while inflating. That result is not valid. That result can never be accurate. So it has been tampered with. There is no integrity in that result. So for home run blood pressure monitors, we have these two because when the cuff is too big, it has its own implication. When the cuff is tight, it has its own implication. Now, when it comes to the next source of errors that we have discovered, it has to do with cuff accuracy. It's actually very painful that my slide is not showing. You will have seen some of these implications that we are bringing about that. And because of this, Omron have moved a step further. We have what we call easy cuff, but we have developed what we call IntelliRaf cuff. Now, this IntelliRaf cuff actually helps to ensure that you get the same accurate result as your healthcare provider's office. We ensure that anyhow they place the cuff around their upper arm, the accuracy is guaranteed. And that is the step we have moved on to ensure that whatsoever our patients are checking, whatsoever the healthcare providers are using, the accuracy is actually guaranteed because that is the phase that we have. And for us to solve this problem, we have developed what we call an IntelliRaf cuff. This cuff offers 360-degree accuracy. That's what we call it. Anyhow it is being placed around the upper arm, the accuracy is guaranteed. That is one of the things we have offered outside the fact of the validation that all home run blood pressure monitors have gone through. And please let me say this, there are some devices in the market, they look very cheap. People say, oh, they are cheap, they are that, but they are not validated. Some of them do not even put it there because they know. But some can even go above and just write it because they know that nobody is going to harass them, nobody's going to check them. When it comes to validation, the number. Okay, sir. When it comes to validation, the number. Yes, I can. Okay. I can. Yes. So when it comes to validation, the data is actually there on the internet. You can actually see the data of devices that are validated. And lastly, as I close the first section, we also have a device now that Omron has launched in order for people to check their blood pressure accurately. We call it Omron M1. Omron M1 is actually a low-price device and it's cheap, but it is validated and also offers accurate results. So that's the blood pressure that you can get as low as between 21 to 25,000 naira. You can have a blood pressure monitor that you can use for 3 years, and you are sure, the most importantly is that you are sure that your result is accurate. And lastly, when it comes to Omron blood pressure devices, battery strength does not affect results. I've had people say that when it comes to digital devices. For Omron blood pressure monitors, if the battery inside your device cannot offer you accurate results, the device will rather not give you results. And these are the things we have put in place to ensure that accuracy is guaranteed. So as we celebrate the World Hypertension Day and our May measurement month of hypertension awareness, we are saying that overall blood pressure monitor is still your #1 partner to ensure that we measure our blood pressure accurately. Thank you very much this morning, everybody.
Oh, thank you very much, sir. That's a beautiful presentation. And we still hope to get more from you during your second presentation. Thank you for that work done. God bless you, sir. Before I move ahead, I need to introduce some special people here because I have the immediate past president of ACPAN Nigeria and the present president. But if I will want Mrs. Pharmacy Alade Sami to get herself prepared to introduce other people that I may not be able to know, especially the Expo of ACPAN Lagos. But I want to say this, that we have in our midst immediate past president of ACPAN, Nigeria, Dr. Adeyeye Arigbabuwo. You are welcome, sir. If you are there, just say a word to us, sir.
Thank you very much. Good afternoon.
You are welcome, sir.
My pleasure to be on board, and we're proud of the present leadership of ACPAN Lagos State. Paula Abiola Jose, proud of the entire team. Farm Alade Somin is there also, and vice chairman, and that's Dr. Yenuchi. In fact, we are proud of the entire team, and we're proud of today's event. So we're on board, monitoring and supporting, while I also say good afternoon to my current national president, Dr. Austin Aipo. Thank you very much, and God bless you.
Thank you, sir. God bless you, sir. Also in the same, I have the honor to introduce or welcome on board our current national president, Dr. Austin Aipo. You are welcome, sir. Can you just say a word to us?
Yes, thank you very much, moderator. I want to thank the chairman, Dr. Mrs. Biola Polizier, for arranging this all-important webinar. I am sure that our Lagos providers will have a lot to gain from this webinar. If you ask me, this webinar is long overdue, but we thank God that it's taking place today. And we hope that at the end, members would have gained so much. Thank you very much.
Thank you, sir. That's a great one. We have all the power that be in our midst. And therefore, since we have Abraham as our father, we should fear nobody. We can go ahead. We thank you for this support from the national. I will call on Pharmacy Mrs. Aladisome to help me to do some little introduction of those who may not be able to know or who may not be able to feast their title in order not to offend anybody or step on toes. Pharmacy Mrs. Aladisome, please kindly bail me out. Thank you. Are you there, ma'am? Hello? Are you there?
Yeah. Yes, sir.
Yes. Kindly bail me out some introduction of the VIP among us so that we can move to the next level.
Okay, can you hear me now?
Yeah, we can hear you.
Oh, okay. Okay. Good morning, everyone. Once again, you're welcome. I think you have done the introduction of the VIPs among us that I can recognize. I'm trying to go through the list of attendees. I think, okay, I'm going through here. We have so many people here. I'm not sure. I can see Mr. Igwe, you're welcome, sir. I'm not sure of any other person. Maybe the vice chairman can help because he's supposed to take the chairman's opening remarks. Thank you, sir.
The vice chairman, that's Dr. Emmanuel, please.
Deputy, okay, thank you. But, do I go on with the chairman's remark?
Okay, if the chairman is not yet available, then the battle is now on you, sir, to do that. And as well, please use the same opportunity to just recognize one or two of your ESCO members who may be on board, or anybody you feel we should know that they are there.
Hello.
Thank you.
Okay, okay, Chairman. Team Chairman is more audible now. Chairman is here.
Okay.
Oh, to God be the glory. Madam.
Okay.
You are welcome.
Thank you very much. Yeah.
Yes, you are welcome.
Thank you very much.
Yes, sir.
Good
afternoon. Okay. Good afternoon, ladies and gentlemen. I must apologize for all the network issues, phone issues that made it impossible for me to start with us. I entered the webinar Zoom precisely 11:35 so as to position myself. Unfortunately, about that 12, a lot of things went wrong with my phone. But thank God, I'm just in time. I was not even sure my sound, the voice will go out. But let me just run to thank you, Dr. Oyenuche, my able deputy chair. I had already passed the information to him that he should take it. But you see hear his voice later in the course of the meeting. So I hereby welcome all healthcare providers to this first webinar in the year 2023. As you are aware, capacity building is one of the key objectives of our association, and that is the reason this webinar and subsequent capacity building programs are very essential. Over the months, we as an ESCO have tried to put our house in order, though we have been faced with a number of challenges. First of all, I must apologize for the late announcement of today's webinar. We had proposed the webinar for March 2023, but we kept postponing the date because we could not get an audience for Port CVC to key government agency we had wanted to collaborate with. But now at least we seem to be getting some results. Secondly, let me quickly give an update on our activities in this last month. Since our last webinar meeting held in November 2022. We have finally been able to resolve the change of signatories to the association account. We have launched the members registration platform for member registration and payment of dues. We have reached out to Lashma, NHIA, the Ministry of Health, precisely the Commissioner for Health, FEMA for appointment for courtesy visit. We have paid the GM Lashma a courtesy call, and we have also made an unscheduled visit to NHIA Yaba, where we met with the acting zonal coordinator. We have attended programs of a number of our affiliate groups. We have submitted a memoranda towards the drafting of the operational guidelines of NHIA in February 2023. We want to say thank you to all affiliate bodies that contributed. We have also had two expanded ESCO meetings with the vice chairman of various professional groups. Update on our forthcoming HTPAM events. The second leg of our capacity building webinar will hold on June 6, Tuesday, 2023. Details will be shared on our various platforms. This time around, our engagement will be with NHIA, Lagos State Zone precisely. Membership registration has commenced, but the response has been discouraging. Only about 10 providers have registered. Please endeavor to go over to the website and register and remit payment of 5,000 Naira only. The procedure will be shared again. It's such a seamless procedure. If digitally advanced people like me can maneuver it, I believe every other person should be able to. Our media meeting is slated for June 20th at LCCI Alausa, Ikeja. We have started sending out letters for sponsorship, and we also request sponsorship for companies, hospitals, specialist hospitals, companies, corporate bodies, NGOs. Please, we are available for every form of sponsorship, exhibition, presentation, decorations, hot branding, etc. Kindly block the date for attendance. We're expecting the guest speakers from NHIA physically, our own zonal coordinator, Mr. Femi Akinbade, as well as the GM Lashma, Dr. Zamba. Please make it a date and keep it in view. Our AGM, by God's grace, will take place come September 2023. I cannot end this short brief without first appreciating all those that are present, especially all the people that we have been collaborating with, working with in these past few months that we started, as well as those that have been running the race of HCPAN since inception. People like Dr. Arigba Buwo, our whole national president, Dr. Aipo, Dr. Akintade, a former chairman of this state, Dr. Aino, a former chairman, Dr. Omolola, Pharmacist Lawrence Kaito, my own past chairman in PSM, Pharmacist Yola, Mr. Olatunji, a number of our people, ARN, Oduwole, that's always ready to give a helping hand. And all my ESCO members, of course, if I've not called you, it's not to undermine you. And mommy, Dr. Laniba, I guess she should be on the call, and we will be recognizing as many as we can pick out in the course of the session. At this juncture, I want to welcome you once again to today's webinar. I would advise we sit back and learn from our guest speaker of today, Dr. Ijimakin. At the end of the presentation, we'll have a period of question and answer. I want to appreciate our sponsor for today's program, New Ice Farmer. Kindly endeavor to patronize them. We won't be having tea break as it were, but I will advise you get your teacup ready, get your jotter ready with your writing pad, and begin to jot things down as we discuss on, as we have an engagement with Lashma Lagos State, and then we discuss on the quality framework for healthcare providers. Wishing you a very rewarding webinar session. Thank you and God bless. Over to you, MLS.
Thank you.
Abimbola Adekoya.
Thank you very much. Can you see? The devil will never have say in whatever we are doing in Jesus' name, because this is just the speech we should not miss at all. Thank you, Ma. We appreciate you, and we know with your leadership, HCPAN Lagos will move to higher place in Jesus' name. Now, the next thing on the agenda, as we all know, I have highlighted the item of the agenda. The next thing we have is for me to introduce our speaker for today. I want to introduce to you Dr. Olufunke Ijimakin. He's a medical doctor and a health quality improvement professional. He holds a master's degree in business administration from Business School, Netherlands. She also had master's degree in public health and a postgraduate diploma in health, safety, and environmental management. She has worked in different capacity with formal and informal health insurance scheme and supervised the implementation of different ISPO approved quality improvement program in rural and urban hospitals in Nigeria. She is result-oriented, analytical, resourceful, and has established a track record of achieving exceptional results working with individuals with diverse backgrounds. Please permit me to welcome on board to do the presentation today on the topic framework towards achieving universal health coverage. I welcome aboard Dr. Mrs. Ijimakin. She is a quality assurance consultant, Lagos State Health Management Agency.
Thank you very much, sir. Good afternoon, all. Good afternoon. First of all, I'd like to say a good afternoon to our host, the HCPN president, the HCPAN president, Pharmacist Abiola Pauluze. Thank you so much. I would also like to recognize our able and wonderful general manager of Lashma, Dr. Emanuela Zamba. Thank you very much for giving me an opportunity to talk. I also recognize the national president, Dr. Austin Aipo, past president, Dr. Ariba Bui, Dr. Akitade sir, my senior mentor. Thank you very much, sir. And I also see on the platform several members of the senior management team of Lashma, Mrs. Aditoro, Ms. Abiodun, and Ms. Mrs. Badijo, all able and here to have this engagement with members of the HCPAN and fellow healthcare providers. We're quite excited to be here today, and we look forward to wonderful discussions and deliberations. My presentation this afternoon, all right, is titled Embedding Quality in the Lashma program. I don't know if I'll be able to share my slides myself. Is that possible, sir? Okay, yes.
It's possible. Go ahead, ma'am.
Okay, thank you so much. Okay, thank you so much. Can you see my slides, please? Hello? Can you see my slides? Okay, yes, so we're good to go. Embedding Quality, the roadmap for the Lagos State Health Management Agency. And I'll go straight to the outline. This is our outline. We have an introduction, quality framework, implementation overview, and so on and so forth, then documentation for onboarding. All right, so first of all, I'd like to give an overview of the Lagos State Health Law and also the Lagos State Health Scheme Law, as well as Lashma, what we do. The Lagos State Health Law was actually enacted on the 25th of May, 2015. And what does the law actually state? The law establishes, one, the Lagos State Health Scheme, and we recognize that this Lagos State Health Scheme is a mandatory health insurance scheme. It's to ensure that all residents of Lagos State have access to affordable and quality health care. All right, and I must stress and emphasize it's mandatory for everybody, every citizen living in Lagos State. The law also further established the Lagos State Health Management Agency, and the agency is charged with the responsibility of ensuring the effective implementation of the health insurance program. And then we have the Lagos State Health Fund, LASHEF, which is an independent fund and a risk pool where all health insurance premiums for the Ilera Eco health scheme are paid into, and it's managed by Lashma. This fund, I must mention, is reinforced by the law. What are the objectives of the scheme? One is to ensure that all residents of the state have access to quality and affordable healthcare services. Two is to protect families from financial hardship of huge medical bills. We want to protect families. We don't want them to pay enormous medical health bills and therefore push them further down into poverty. We want to limit the rise in the cost of huge medical bills. We also want to ensure the equitable distribution of healthcare costs, and we want to maintain a high standard of healthcare delivery services within the scheme in the state. Now, I would like to give you an overview of what the agency looks like. The agency has 3 arms for implementing the scheme in Lagos State. We have the Lagos State regulations, and this arm is entrusted with the responsibility to implement the mandatory health scheme. It's a scheme that is mandatory for every citizen, and they're beginning to ramp up actions to implement and enforce the mandatory scheme in Lagos State. Then we have the Lagos State Social Health Insurance Program, Ilera Eco program, and this program offers the standard health plans as a benchmark, the minimum for all health plans obtainable in the state. And we also have other health plans I would mention later on. And then we have the EcoSha. EcoSha stands for the Eco Social Health Alliance, and this is the resource mobilization arm of the scheme, of the agency, that helps mobilize funds or secure funds that will cater and pay for the premiums of people who are less privileged and the vulnerable people in our society. So that's a quick overview of the Lagos State Health Law, the objectives, Lagos State's health management agency and what we do. And I must state that the agency has done a lot since inception. Actually, the agency started its operations fully by selling the plans and reaching out to different LGAs in Lagos State between 2019 and 2020. And you can all testify that the impact of COVID actually hindered a lot of things, but at the same time, it was an avenue, all right, for us to become innovative and creative in the agency. And today, we have over 200 providers on the scheme and counting, because every day we have providers who are submitting requests to join the scheme. And we also have over 700 enrollees and counting. So the agency has done so much work in trying to reach out to people. And we're not resting on our laurels. We're still going to engage. And part of our strategy, all right, this year is to embed quality, because we understand that to achieve quality, to achieve universal healthcare coverage and ensure that everybody comes on board and we achieve the positive health outcomes we're looking for, we recognize the importance of quality and how the role quality has to play in the scheme. And the agency has developed a framework, all right, that looks to ensure that quality, when we embed quality, we're going to embed it in a way that it will foster patient engagement and feedback. We'll engage the patients, obtain feedback, and that feedback, all right, will be used to also improve the scheme, all right? And we're doing this by setting up the Lagos State Health Scheme Service Charter. I'm sure you're aware that we launched this charter sometime a few months ago, all right? And we're going to be getting feedback from our patients and clients, and we'll be sharing this feedback with providers also. We also have, we're going to also engage and enhance provider networking and collaboration. We need to engage providers, and this is an example of engaging providers. 2 weeks ago, we held our first Delira Eco Providers Forum. That was the beginning. This is another opportunity for us to engage with healthcare providers, let them know what we're doing as an agency, our plans, all right, our strategy, where we want to go, and how we need you to collaborate with us to reach our goal, all right? We're also, this quality framework that we have also designed ensures knowledge transfer and skills acquisition amongst different cadre of healthcare staff. The framework will also ensure that we have care tools to improve patient safety. And also the framework we have designed is one that will ensure that lessons we have learned from quality improvement projects, from audits that we have conducted, from incidents that have occurred, from mortalities, reviews, and from other ethical dilemmas different hospitals have encountered, we will share this amongst ourselves, all with the aim to improve care in every individual hospital. At the end of the day, everything will there will be a summation of this improved quality of care, and it will improve the general healthcare outcomes in Lagos State. All right, our quality framework is also based on certain principles in healthcare quality. One of them is it's based on healthcare quality domains. Our framework has taken into consideration that, one, the care we provide in the network, it must be safe care, it must be patient-centered care, it must be timely, it must be efficient, it must be effective, it must be equitable, and also it must be integrated care. And the framework also is designed in such a manner that we have incorporated the quality management system principles, which involves planning for quality, quality assurance activities, quality control activities, and quality improvement activities. I'm not going to go too much in depth in these particular areas, because I think at this point in time, it will be too much knowledge, but I'm just showing you that the framework we have designed is holistic, is structured and standardized. All right, now this is a diagram. It is a diagram that gives a quick overview of what the framework looks like and things we have incorporated, as I mentioned, the healthcare quality domains and what we hope to achieve, the drivers, the healthcare quality domains, how it's going to impact the care we give, the network itself, the provider network, the innovations that would occur as we go along and improve healthcare quality, and the future, what the future looks like. All right, so what are some of the drivers in our quality framework? Number one, we have an enabling government policy. We also have an improved empanelment process, and that means an onboarding process for providers. We have realized that yes, the provider network and the provider empanelment and onboarding process was a little strenuous and also quite complex. But today we have improved it, we have worked upon it, and we have removed quite a number of bottlenecks. All right, and we have an improved process that I will share with you today. We also have the quality improvement plans. We're working with Safe Care Farm Access. All right, Safe Care Farm Access is a non-governmental agency. They have a quality improvement, accredited quality improvement program. It's accredited by ISQA. And we are recommending that all our providers key into this program. All right, it's not a recommendation, it's actually mandatory for you to have a quality improvement, accredited quality improvement program that you are implementing as a provider in the Lashma or the Ilera Eco provider network. Also, drivers of our quality framework includes the adherence to regulations and guidelines, enhanced engagement with providers. We will have care reflective reviews. We're going to sit down and look at the care given every quarter across the provider network. We'll have training and skills acquisition programs. We'll engage our clients, all right, and obtain feedback to improve care. Now, as I said, we have built into this framework the fact that it must be, whatever care we're giving must be safe, effective, integrated, efficient, patient and community-centered, as well as efficient. Yes, I've said efficient, yes. And what are the outcomes at the end of the day? We hope to have developed a culture of patient safety and service excellence when we implement and use some of these drivers in the program. We'll be able to develop a culture of patient safety and service excellence. We'll be able to deliver excellent evidence-based care. We'll be able to achieve excellent outcomes that our enrollees deserve. And also we will continue to develop innovative strategies of meeting the healthcare needs from the information and the data we collect. Our aim is, yes, quality care through an extraordinary network of providers in Lagos State, providing extraordinary care, utilizing extraordinary innovations to provide and achieve an extraordinary future where we have a mandatory healthcare scheme being implemented in Lagos State. All right. This is the implementation overview of the quality framework. We're raising awareness that yes, we have a framework, we have activities we're going to carry out. We're also going to design for quality and patient safety. We're also developing tools, we're developing charts, and also developing skills acquisition and training manuals and programs for providers. Once we begin to involve the users, you are the users, healthcare providers are the stakeholders, we begin to roll out these programs. We're going to continue to monitor and evaluate to see that, yes, we're actually impacting and improving the quality of care in the scheme. We're going to be learning and sharing the knowledge, lessons learned from these activities. And as I mentioned also, that it is mandatory that every provider in the Ilera Eco scheme must participate in our activities. If they don't participate, if they're found wanting and not attending these programs, we have the beautiful arm of Lashma that we love. It's called Lashma Regulations Department, who would help us identify, who would work with to ensure that erring and defaulting providers are engaged, and not only engaged, we should find out why they're not involved, and if despite encouragement, despite engagement, the necessary sanctions, penalties, and disincentives may have to be applied to them. All right. Let me go a bit into depth or in depth in some of these activities. We said raising awareness, we'll carry out trainings and also conduct educative programs. We would definitely work with different teams. You'll see us having meetings at different levels, at the IBILE level, at the LGA level. All right, we have partners who are also interested in working with us in different areas of the Ilera Eco program. We'll also look at having risk management forums, communication strategy programs. We will conduct appraisals and audits, and we will be holding providers accountable for the care they provide in each hospital. We are, as mentioned in the implementation overview plan, we're going to design for quality, and the designing for quality, we're talking about standardization, effective communication, human resources. We would look at human resources for health and how we can engage with different providers, all right, to develop innovative strategies, because we know this is a serious challenge across Lagos State and Nigeria as a whole. We're looking at developing care bundles and designing care bundles. We will definitely be introducing and ensuring surgical safety checklists are being implemented across different hospitals that provide surgical care. Effective handovers will definitely be looked into. We'll be designing templates for effective handovers, debriefing exercises, and development and designing effective committees in different hospitals. We'll be conducting monitoring and evaluation activities regularly. We'll be collecting reports, identifying selected or using selected indicators. We would have a reporting format for risk management, adverse events, all right? And we will also have clinical case audits and reporting of documentation case audits. Regular system analysis will also be conducted. We will involve our patients. And how are we going to involve our patients and our clients? One, we will want our clients to also discuss with us that when they go to the hospital, what are the hazards they have identified? What are the delays, or what are the things that happen in the hospital that they want us to work on? Is it staff attitude? Is it particular things they have seen in hospitals that they're worried about? They will engage with enrollees and clients, and we'll use this feedback to also help roll over into our improvement plan and into our design for quality. We will take this feedback also and learn. We'll integrate it into our clinical audits, risk reports, and use complaints to identify trends also. We'll develop evidence-based strategies and showcase evidence that learning shared is actually improving the quality of care in the scheme. All right, so I've talked about the quality framework. I've given an overview. I've given an overview of the implementation plan, and now the structure, people responsible. We can see this table here. We have Lashma and identified stakeholders who will be involved in also engaging more providers to join the scheme, all right? And this activity is going to be continuous, but we'll be reporting on the expansion of the provider network monthly internally. We want to see, we're saying it's a mandatory scheme. We need more healthcare providers on the scheme, primary healthcare facilities, secondary healthcare facilities. We need them to join the health scheme because our healthcare packages provide our benefit package covers both primary and secondary healthcare facilities, healthcare services. The Lashma quality team will be involved in conducting baseline assessments. Apart from that, working together with Safe Care, we would also be engaged in periodic visits to providers. We'll also be conducting case audits, clinical audits. We'll be hand-holding providers, mentoring, coaching, and training. All right, and we'll be providing reports on this. We'll also have partners who develop training manuals, skill acquisition programs, and also patient safety tools, and we'll be introducing this into the network. We have Lashma regulations that will work with us to ensure that, yes, we all comply to the regulations, and we have the service charter who would help us obtain feedback from our enrollees about enrollee experience through the patient journey in our hospitals, and we will use this feedback to improve quality of care. And by God's grace, we will get to see the patient satisfaction index improve and increase. And as quality is improving, we know that patient satisfaction will improve. We know that the word will go out there that our providers are actually providing quality, excellent service, and more people will join the scheme, come on board, and we have more enrollees. This is very, very crucial. As I earlier mentioned, we're going to be working closely, the quality department of Lashma will be working closely with the regulations department, all right, to ensure compliance throughout the scheme, and the regulatory department will be doing some of these activities on this slide. Now, we talk about balancing it. So we have the stick, but at the same time, I'm very happy to inform you that under the guidance of the GM of Lashma, we will also be introducing not only the stick, but the carrots. And the carrot is being introduced as incentives for providers who are working to improve quality in their hospitals. Very, very, very crucial. Based on the progress achieved in the standardized quality improvement program, that is the Safe Care program, we will be able to identify which level a provider is at the beginning when the provider joins the scheme. That is the baseline survey. And as we work with the provider to improve the quality of care, we expect that provider to move from one level to another. The Safe Care Quality Program has 5 levels, level 1, 2, 3, 4, and 5. So if a provider comes in with a level 1, and we start working together on this quality journey, after 12 months, we don't expect that provider to still remain the same. We expect that provider to have improved, all right? And therefore, we're looking at vertical incentives. These vertical incentives means ensuring that providers that are doing well on quality have enrollees in their facilities, and providers that are not doing well in quality, the number of enrollees they have will be capped. Now, this is not being mean or being vindictive, but we just have to implement some risk measures to safeguard our patients. We don't want patients to go to hospitals whose quality is low, and therefore we are worried about patient safety issues in such facilities. So we will not expose hospitals who are not doing too well in quality to a large number of enrollees. We will peg the number of enrollees that kind of provider will have, all right? And if a provider is doing so well, we will not need to peg the number of enrollees they have. When enrollees select them, all right, they can choose those providers as their choice, all right? We will not peg the number of enrollees such facilities will have. Now, for horizontal incentives, we're looking at providers who provide specialist services. They could be given, they will be looked at, we'll be implementing special tariffs with them. And then for providers that are doing so well, they're maybe on a safe care level 4, 5, or they're even on an international accreditation program, for example, JCI, COSASA, all right? Such levels might even be given further considerations and be provided with special tariffs. This is what we're introducing into the scheme this year. All right, as I mentioned earlier, the stick to this is that failure to progress in a quality improvement program, all right, would lead to a sanction. And also there will be a sanction if a patient, if a provider who is on a very high level of the safe care program drops to a lower level, it will attract penalties, because we want you to be, it's continuous quality improvement journey. It's not when we're coming for audits that you just improve. No, we want it to be continuous, steady, and it is implemented continually. All right. Enabling factors for us to be able to actually implement or embed quality into the Lagos State Health Scheme. We cannot do it alone. We need the leadership, the involvement of the leaders or the management in hospitals. And we're engaging with medical directors, engaging with senior members of staff in hospitals. You have to be on board with the program. Also, we're going to be engaging other healthcare providers working in each hospital, the pharmacy team, the nursing team, the laboratory team, all right, support services. We would engage with different members in every hospital. Why? Because we know that it is not just the clinical care that we're going to focus on, we're going to focus on the whole, all the services rendered in the hospital holistically. There's also a need for us to ensure effective communication. So we're going to have a communication strategy, a communications template, whereby whenever there's information to be cascaded or circulated, it will go through the right channels and reach the right people it's supposed to get to. We also would like to appeal that for us to be successful in implementing this quality improvement framework, we need to develop a learning culture and mindset, because we're going to be learning. There's so much to learn. The learning never ends, it's continuous. And also the enabling factor, one enabling factor towards ensuring the successful implementation of this framework is we have introduced internal and external incentives. All right, I mentioned earlier that one of the bottlenecks we identified and is in expanding the Ilera Eko network was the onboarding and empanelment process. And we would like to share this with you today that we have improved this process. We have made it more efficient, more straightforward and simple. And so what is the process? Number one, if you're interested in joining the scheme, we will tell you what it takes, what your hospital has to put in place to join the scheme. And that assessment tool we will give you even before we come and conduct the assessments, so that you have an idea of what Lashma is looking out for when they come to inspect your facility. So you can spend a month or two before you invite us for the audits to put your facility in order, such that when we come, we inspect your facility and you pass the assessment. All right. Then the Lashma Quality Assurance team will come once you have notified us. We will inspect your facility and we will give you feedback reports. We've also made it very simple because we don't want to discourage providers, and I will share with you that process. All right, I have a workflow that we share, or a process map that I will share so that you understand how easy it is. We will onboard you and while you're being onboarded, you can begin to implement the remedial actions in the feedback report. We will conduct orientation and training, all right? And once you're able to tell us that, yes, you have met the remedial actions, we will place you on the provider network list so that enrollees can begin to select your facility and join the scheme. And you can begin to enjoy the financial remunerations of being on the scheme, that is capitation and fee for service. The advantages of this process is that, one, providers will be aware of the gaps even before we come for inspection and can begin to implement corrective measures. It's a more efficient process. You don't have to pass through multiple agencies before Lashma now begins to engage you. And then even as we're doing this, we're already, as you're being onboarded and being empaneled, you're already beginning to understand the principles of quality as assurance or quality improvement in the process from inception. So this is the flow chart. Provider expresses interest, all right? And within that period, we give you the assessment tool. Within 1 month, we come, we visit, we inspect, we give you feedback on the report findings, all right? And if you have passed the cutoff mark, all right, we onboard you into the Ilera Eco network immediately, and then you can begin to start the administrative process. Now, what is the administrative process? The administrative process is, one, you have to sign your contracts, you have to sign get stamp duty and submit back the contracts, the signed contract documents. But you are already on board. That is the beauty. We have onboarded you. If you do so well in your assessment, we would even put your name on the provider network list, and enrollees can begin to be sensitized that their hospital of choice, their favorite hospital is coming soon, and therefore they can begin to say, we're going to choose this hospital, we're going to choose this hospital. That provider onboarding process, while you're on board, can take 5 months, all right? But you have already started earning capitation and fee for service. At the end of 5 months, you must have completed your onboarding documentation process. All right? If you have not, we would apply sanctions and penalties. That means we might have to delist you. But if you have completed it, we would approve and confirm that you're a provider. What are the administrative steps that you have to do within those 5 months? One, you have to obtain your LSHS corporate identification number that you can obtain from Lashma. You just come to the Lashma office at Alausa, Kefi Street, and we will put you through, the regulations department would put you through how you can obtain your SIN number. It's backed by law, I must state. Then the PPA registration for the current year. We also have a liaison officer that will work with you to obtain your PPA. But the PPA process actually now is so straightforward that even from the comforts of your office, you can obtain PPA online. But if you're worried about the process, we have an officer in-house that can guide you on how to fill the forms online such that you choose the appropriate band and you are charged appropriately for it. You show us your farmer license for the current year. You show us that you have evidence of a 24-hour contact center. It's just a phone line that we can reach that facility even at 2 a.m. And then you have evidence of ICT infrastructure, a computer and internet access. All right. For the PPA onboarding, you would definitely have to upload your director's credentials, your CAC documents, the company memorandum and article of association as relative, the pages relevant, application letter for registration, and then the CV of 3 key staff. These are the documents required for PPA registration and onboarding. But we have made it so easy now that we have liaison officers, people that will hold your hands through the process to ensure that, yes, you can get on board, registered, complete your forms all within 1 month. But even if you cannot complete it with 1 month, so far you pass the assessment, the quality assessment tool, we will give you a leeway of 5 additional months to complete the onboarding process, all right? And then after 5 months, we will check up, have you completed the process? If not, I'm referring back to this flow chart. If not, we would have to remove you from the scheme. And if you have, you'll be confirmed a provider. Okay, so what have I in summary to summarize? I must state that quality is a journey. Lashma is keen on embedding quality in all its activities, all right? And all Ilera Eco hospitals must participate in the quality-related activities. I've also mentioned that we have an improved empanelment system to bring and encourage more providers to join the scheme. This system or this process is more efficient and more provider-friendly. In conclusion, I must state that just as Tedros mentioned at the Ministerial Patient Safety Forum this year in 2023, he said, if it is not safe, it is not care. The kind of care we want to provide for our enrollees in Lashma is care that is safe, timely, efficient, effective, patient-centered, and integrated. We're embedding quality to improve care, also ensure that our patients are satisfied, improve healthcare outcomes, and also to drive further enrollment in the scheme. All providers on the scheme will definitely benefit from having more enrollees enrolled into this program. I would like to share our phone lines and numbers you can contact us with. These are the numbers, and I would like to end here. Thank you very much. Over to the moderator.
Thank you very much, Ma. This is beautiful. So just say, well done, Ma.
Thank you very much,
please,
sir.
I want to say this, that if you have any question, yes, if you have any question, direct it to the boss. We'll definitely, chat box, we'll definitely get it and get across. I will recognize also some of our dignitaries here, or I can see here, I think Dr. Adenike Olanimba. You are welcome, Ma. Also, I can see Dr. Pamela Ajayi. You are welcome. Dr. Pamela Ajayi is the president, head. Ma, can you just say good day to us, Ma, if you are there?
Good afternoon, all. Thank you very much.
Hello.
It's been an excellent lecture.
So, Dr. Olanimba, can you just also say good day to us?
Good afternoon, Dr. Ejimake and all HCPAN members on this webinar this afternoon. I'm sure the moderator is not aware that Dr. Olaniba happened to have been a past president of Healthcare Provider Association of Nigeria. I want to appreciate the effort of Lashma. My hospital is already a member on the Lashma program. And I have a little bit of reservation on the implementation so far. But I'm happy with this presentation because Dr. Ejimake seemed to have deliberated on how things can be made easier, how providers can have a soft landing in participating in this program. One of the things I will want Lashma to look into, number one, the capitation is rather low. We will want Lashma to look into that. If we're talking about quality, quality is not cheap. I take into consideration that Safe Care is going to assist to make sure that we scale through the 5 levels. So I'm looking forward to how Safe Care is going to assist providers to go from stage 1 to stage 5 within 1.5 years. That has been enumerated. Because I believe that 1.5 years is not adequate. Another gap that I have observed since the implementation started is that the fee for service is not being processed adequately. We've been having a lot of challenges in getting refunded for fee for service. So Lashma needs to look into that as well. I think I want to stop here in the meantime. Thank you very much for this very educative lecture, Dr. Ejimake. I appreciate you all. Bye.
Thank you, Ma. I'm deeply sorry for that omission. Also, I want to also recognize the former past president of the HCPAN, Dr. Sanda. I saw him on board recently. Possibly is off from the platform. But as soon as he comes back, welcome. Thank you. God bless you all. The next we have on this agenda will be the question and answer will come immediately after the presentation, the second presentation by New Height Farmer. Please let us prepare our question so that we will have, it's going to be interactive so that we'll be able to discuss it. Why we can assure you that Dr. Olufunke Ejimake is still around to attend to all the necessary questions that may arise as a result of this. Now I call on the New Height Farmer to do the second presentation.
Thank you very much, sir. All protocol duly observed. Please permit me to stand on the existing protocol. And I want to appreciate attention throughout. So for the second presentation, okay, Can now share my slide. I want to believe everyone can see our slide. Please, my slide now. Okay, good. Now share it. Okay. Yes. Hello. Hope you can hear me.
Yes, we can get to.
Okay. Yes, for the second presentation, I would like to talk about one of our products, pharmaceutical product called the Wasen Selenium ACE plus D. The reason why I would like to talk about that is that as we measure the blood pressure across ensuring maintaining our healthy pressure, it's also good that we ensure that we maintain our immune system, because one of the things we've discovered that are also impact on blood pressure of Lagosians especially is stress because of the nature of our work. And on that, I would like to talk about the product called the Selenium ACE Plus D. I know this product is not very strange to a lot of us. We've been using it for many years. But what I just want to talk about is the fact that selenium, as we know, is actually the central of healthy working immune. And in addition to selenium, we have the vitamin A, the vitamin C, the vitamin E, and now also the vitamin D. I know that even with the experience of COVID, everyone now pay attention to the immune benefit of vitamin D. Now, what one of the major things for us on this is the fact that for the selenium is actually a very trace element that play a major role in our immune system, as mentioned earlier. And the selenium that we offer through this product is actually organic selenium. Now, what that tells us that it has a high level of bioavailability in the system, therefore protecting the immune system better. Now, there are a lot of other selenium contained supplements out there, but most of them are offering inorganic selenium. But when it comes to Wasen selenium, which is what we offer, it actually offers us an organic selenium, which is very good for even vegetarians and all that. And this put us in a position of having a high level of selenium in our system. So also, we know that selenium has a potential benefit in relation to cardiovascular disease. So like I said, my first presentation is on high blood pressure, but this is also a product that can play an important role in cardiovascular support, talking about oxidation support, talking about managing antioxidants and all that. So selenium supplementation is actually beneficial, especially for people that are low in selenium. And I know that when we look at ourselves, our diet in this part of the world, it's obvious that we are low in selenium. Now, so like I said, we use selenium enriched yeast, not an inorganic selenium. And this actually improves the bioavailability of this product in our body, in our system, therefore giving us a very protective benefit of immune. And that is just a few things I want to be talking about. I've talked about the blood pressure at first. If there's any other question, because there are some questions I've actually attended to on the chat. If there are other questions that want to come, I'm actually very available. But on this time, what I'm also bringing to the table in this second presentation is our Wasen selenium mix. It's one per day, a pack of 30, and it's very good, especially for HIV patients. It is because of the high impact on immune, high support that it gives immunity. It's actually one of what you can recommend. I use it daily. It's actually good for stress and fatigue, which is one of the most common issues with Lagosians, especially. Many people treat malaria back to back, all just because of stress management. Thank you very much. I'm open to questions now. Over to you, sir.
Mr. Adekoya, are you there? Okay, while he's getting back without much delay, we thank you so much for the presentation. I think we can take the questions so that we can also take that of Lashma. Mr. Adekoya, are you on now?
Yes, thank you very much, Dr. Mark. I'm very grateful. Then we can now go for the question and answer session. Question and answer session. So, this question and that of Dr. Dimake will go together. From the chat. That's a big issue.
I think we may not be able to make it together. Let's finish with the presentation, because I know that a few people might want to make comments regarding the Lashma presentation and the rest. So let's finish with the sponsor, and then we now face Lashma presentation.
Dr. Ma, you are going to help me out, because by getting me off, all the question has been cleared from my chat.
Okay.
If you can get some there.
Okay.
So let's see, because it has cleared all the questions from.
So let's deal with the one for our sponsor first, after which we can now focus on the presentation from Dr. Ejima. So we can look at the ones.
Please kindly help me out. I don't have any question. I don't have any question for my chat. So if there's a way you can help me so that we can get it up.
Yes, that's what I'm looking at the chats. There are not much questions for him on the chat, except the one he said he has taken. So probably people can raise their hands and then they are recognized to ask questions direct.
Okay, that would be another option. If there is a question,
yes, Dr. Akintade,
direct and then.
Dr. Akintade's hand is up. You have the floor, sir.
Thank you very much. Omron question. I want to appreciate everybody for the program so far. I am concerned because of your presentation, especially the first one. The second one, I don't have any challenge with that. Any nutritional supplement is good for anybody. But the issue of the speak that you said you need to calibrate it every year, which I agree with anyway. So when you are done with selling your home run to people, how do you come back to identify who you have sold it for, and how do you calibrate it continuously? That's number one. You said it can be calibrated online. I'm aware that there are two levels of registration when it comes to calibration of this monitor, and that is the stride BP and the middle valve. Is yours, and I know yours is a UK product, and you know that this registration is a German registration. How do you just oppose that? Lastly, researches are done for the purpose of sometimes, especially when it comes to marketing, to be able to identify gaps where your product can come in. Are you sure you are not within this gap? Thank you.
Thank you very much, Dr. Akintade. So I'll pick the questions one after the other. Like I said, it's a pity I couldn't share my slide at the first presentation. Now, talking about the calibration, all our devices, home run blood pressure monitors, are expected to come for recalibration after 3 years. And we actually do this at our office in Maryland. To pass this to our end users, most of the customers that patronize the pharmacies always get their device back to us, where we recalibrate for them to be sure that it's still offering them accurate results. So we actually partner with community pharmacies around, and for every home run blood pressure monitor from us, there's an after-sales sticker on it where the patient also can actually call directly for more information. Now, talking about the validation, outside the British Hypertension Society that runs clinical validation for us, we actually also partner with Standard Organization of Nigeria here, where we actually have local validation from them. We also have local validation from NAFDAC as well for it to be able to fit into our market space. Now, talking about the market gaps, Dr. Glady, I don't know if I can get more clarity on that, sir.
Well, if you look at the research that you have just shown to us,
yes,
you understand, it's actually identified the reason for validation, the reasons for gapping.
Yes.
And if you look at the research that was actually done in Japan, which of course, that was done 2019 and all that, you will find out that it's also identified the reason for changing awareness of hypertension, but also to add that you must be able to check accurately, which
Yes,
of
sir.
course that has been the standard, but it has not been a policy that we are trying to bring now, which is, and the policy, I am seeing the policy as a means of entering the market through home run, entering the market through that little gap. That's why I'm saying that.
Yes, sir.
I hope
thank you
home run
very
is
much.
not within that space.
No, thank you very much, sir. Yes, we actually are positioning ourselves to take advantage of that. Home run is actually the leading brand, so we ensure we do all that is very necessary for us to be well positioned and to ensure that we are offering accurate readings for our people.
Thanks for your honesty.
Thank you, sir. Thank you, sir.
Thank you for this honest work. Dr. Ma, I hope you are still there. Dr. Emmanuel, I hope you are still there. If you are there, can we go back to Dr. Olufunke Ijimakin's presentation? Or can we just do like this? If there's any question for Dr. Ijimakin, can you raise up your hand and let's identify it?
There are some hands. Sorry, Mr. Adekoya. Some people had raised hands earlier, even during the first presentation.
Okay.
So
let's have
let's give. Yes, please. Let's have. Detunji Remosu raised hand. Please, if you are there, you can enable his mic so he can speak. Comment.
Hello, sir. Thank you. Good afternoon. All protocols observed. My comment has just been on the highly enlightening nature of this presentation, and how I hope that they will streamline it down to the other professional associations. In that same vein, we can make available for this particular presentation the slides and the recordings if it were possible. Thank you.
Okay, thank you very much. They will answer that, but I'm aware that the slides will be sent. So please, we want to say wrap up with New Heights. So we are going to, I don't know if there's anyone on New Heights now. We have looked at the questions, no New Heights farmer, so that we can now read questions that have been sent to Lashma before we take the comments.
Thank you very much, everyone. Bye.
All right, thank you. So we are now to Dr. Ijimaki and Lashma team. We'll first read the comments. Please oblige us so that people who have sent their comments since we can take it before we now take the hands that are raised. This one is from our past national president, Dr. Olaniba, Mr. Olaniba that had spoken earlier. She said, good framework of qualitative guidelines. I hope the socio-economic environment in Lagos will support the providers in achieving this framework. We also have another one that we will abridge from the president of APDPN. I think he's the president of the dental practitioner, private dental practitioners, Dr. Folabi Ogunderu, who also commended the presentation, but is concerned about the tariff, the special tariffs. He said were there actuarial studies carried out to arrive at the current tariffs and the special tariffs to be introduced? Do they take into consideration the current economic realities? Because there has been emphasis on sanctions, but the current tariffs isn't really in tune with reality. So the emphasis is this tariff where there are actuarial studies to, because the exodus of healthcare workers is primarily because of inability to match the economic expectation of workers. Where does providers come in for negotiation of minimum tariffs? So please, we would like Dr. Ejimakin and team to take note of that and respond when we finish reading. Okay. Somebody says succinct presentation. You keep emphasizing hospital. What is in for laboratory center and imaging center in this program? So others who are not hospital, I know attention mostly will be in hospital, but all the others are also providers. What is in it for them? That's the question. And I think it covers pharmacy, covers imaging center, laboratory center, because somebody else has asked where does pharmacies come in. So this is an umbrella question for all that, which I expect that you will also take up. So it's practically the same thing. Then somebody asked, what is the process of application to be a service provider? Which I think you elaborated, probably. Process of application to be a provider. Then somebody, Rebecca Omolara Ajaguna, thanks for the presentation. My question is, do I have to go through Lagos PPA first for registration before coming to Lashma? Or I can come first to Lashma so that I can be put through? I run a maternity home. Bayodele Awosusi. Please, I want Lagos State Health Scheme to partner more with customs in order to ease medical equipment and materials importation into the country, and for also the custom duties reduction. The other second question is can be answered privately. Where is Watson selling sold and how much? Okay. So finally, before you start responding, and then others that raised their hand, okay, it's just the same thing, asking about laboratories, how do they come? So I think Dr. Funke can take the ones we have raised already, and then we now go back to more or the comments from those who have raised their hand. Thank you very much.
Thank you very much, Doctor. All right, so I'll first of all start with the comments made by Dr. Laniba. Is it possible for a hospital to move from level 1 to level 5 in 1 year? Honestly, that was not the message. The message is that we have 5 levels, all right, under the program, the Safe Care program that Lashma has adopted. All right, and we expect you might come into the program when you're onboarded into the program. We'll do a baseline assessment. You could come into the program after the assessment on a level 2 if you are lucky, or you might even be on a level 3, or you might be on a level 1. It depends on what you already have in your facility and the quality processes, the protocols, the guidelines, the policies you have, and to a certain degree, some infrastructure. But I would like to also stress that the Safe Care tool or the Safe Care quality program we are utilizing is designed for resource-restricted setting. That means they have taken into consideration the fact that hospitals in our environment do not have access to unlimited funds. Our funding is restricted. And so the standards the criteria, the benchmark they have put in place are things that are easy to adapt and adopt. They're not going to tell you, oh, you must import something from Japan before we accredit you. No. They have looked at it and said, what are the principles of safe care? What are the principles of quality? And they have designed it with our setting in mind and developed the quality improvement project. So there is no fear. Safe Care and Lashma quality team would handhold you to ensure we make progress. We have designed tools, we have designed templates, we have designed manuals, and there will be trainings and skills acquisition programs for you to go through, just with the aim of moving you from one level to another. And the funny thing is that just being on Lashma, on the Ilera Eco Provider scheme, enables you access to this. Many hospitals in other states or in other parts of Lagos that are not in the provider network do not have access to this as it is and have to pay people, agencies, and NGOs huge sum of monies for this program. And Lashma is making it available for the providers on this. Currently, you did not pay a kobo for the baseline assessment. That baseline assessment, the cost was borne by Lashma and some wonderful donors. So that is even a benefit of being in the Lashma, the Ilera Provider Network. If we bill you for it, it will be, I mean, eventually we might get there, I don't know. But for now, you're enjoying it because you are under Lashma. All right, that is one beautiful thing Lashma has done for all the providers of the network with an aim of improving quality. So I don't think it's tough for you to move from level 1 to level 5. It's not impossible, but it's tough. And all it means is what is the determination, the leadership and the management of the hospital is determined. They are focused. They ensure they carry all the hospital staff along and they have a desired goal within 12 months to move from 1 to 5. But quality is a journey. We don't want it rushed. We want to ensure that you imbibe quality and it's part of your life. So you can decide to move from level 1 to level 2 in 12 months. All right, our cutoff, we'll be sharing the cutoff mark with, the timelines with you. It could be 18 months, but at that cutoff, if you have not moved from one level to another, that is when regulations will be visiting you to discuss and engage more. So that is for Dr. Olaniba's concern. Now, streamline, yes, we are encouraging and we're open to receive other professionals like laboratory centers and radio diagnostic centers. Please, you're welcomed on board. All you need to do is express your interest, send a letter stating your interest to Lashma, and we will definitely work with you. The people concerned, the liaison officers will hold your hands and guide you through the onboarding process and welcome you into the scheme. We're looking for physiotherapy centers, laboratory centers, radio diagnostic centers. Now, pharmacies, the pharmacies, we are being innovative, we're forward-looking, we're trying to do our best to see what it will take to bring them on board, but at the moment, we're still conducting a lot of things in-house, researching and seeing how possible it will be. Very soon, I don't know how soon, but hopefully very soon, fingers crossed, we'll be communicating with all of you. That's for the pharmacies, the pharmacy shops and the pharmacy centers around. Now, the socio-economic situation and how the framework will to ensure, have we taken into consideration the socio-economic situation and the quality framework? Yes, we have. And that is why we're going for the Safe Care tool. We're not adopting a high-falutin quality improvement program that will be so stressful on providers. We're going to one that is adapted for our resource-restricted setting. Tariffs and actual studies, yes, actual studies were conducted. At the time we brought on, we published the premiums, and yes, after 2 years from the initial startup, another actual study was conducted. The current situation, we understand, yes, the inflation trends and things like that, and work is also ongoing on that. And hopefully we'll be back with you very soon. I can't promise how soon, but hopefully we'll be communicating with you. As we said, we want to engage with providers, and that is our watchword going forward. We'll be engaging providers. So as we have information, as the studies are completed, as we have details, we'll be sharing this information with you. Process for onboarding is in the slides, as I mentioned, but if you're interested in joining the scheme, please reach out to us on our numbers. Let me see, I will share this slide again. Yes, so you can reach out to us on our numbers and we will guide you on the process of joining the scheme and handhold your hand. PPA first or come to Lashma. Please call Lashma, come to Lashma first, and we will guide you on the process. All right, we don't want you to have issues at our fellow agencies, so come to Lashma first. We will give you a liaison officer that will work with you, and it will ensure that the process is swift and smooth. Yes. Other questions?
Okay, thank you very much for detailed explanations and answers to those questions. We will take 3 more comments or questions as the time is fast spent, so we can wrap up with the program. So if you have not written, you can raise your hand. But if you've written, let's check the chat, and so they can quickly take it. People asked about. Someone asked about the slides. Will the slides be made available? I think so. Okay, so in the absence of more questions, I think everyone will agree that we have had a great event. It has been a rich program with information. It's as if the Lashma has been waiting for this opportunity. We have done them a great favor to interact with stakeholders, and they have done a good work in taking advantage of this opportunity. So we thank our sponsors who made it possible for us to have this event, New Heights Pharma, and we encourage us to also patronize New Heights Pharma and their products. When next we call you again, we'll be happy if you would like to also sponsor our events. HCPAN is a brand. It's the umbrella that brings all providers together. So it's like a one-stop shop where you can reach out to everyone at once. We also are very grateful to the HCPAN Lagos ESCO, headed by the chairman, pharmacist for Biola Paul Ozie, for great efforts. A lot has gone into make sure that the association is on its feet and is focused and going in the right direction. And the wonderful ESCO that has been helping to make things work. We are grateful to Lashma again, Dr. Funke, Vijimaki and team, and others, even the reception given to us when we visited. We hope that this interaction will continue, and that you will also be flexible to take the sites of the providers. That's the way we can be able to have that package that will benefit Lagosians. This is thanking every other person, all the others, our past presidents, Dr. Ms. Olaniba, Dr. Ade Yaribabuo, Dr. Ma Sanda. When we recognized him, he was off, but we appreciate your presence, sir. And also our current president, Dr. Austin Ipo. We also have from our past state chairman, we have Dr. Akintade, and a host of others, which we may not mention because of time, and even the nationalists that are present. It has been a great time. We appreciate everyone. Our chairman had announced some of our programs. We would like members to also look forward to them. By June, we will have another of this kind of program where we'll be engaging NHIA direct. That's the role HCPAN plays to interface. So we are also, the notice will come out for that program. In that same June, about 20th of June, we will also have our mid-year program. So all those events are going to be, HCPAN is for us all. It's important that we play active role so that we can position it to where it's supposed to be, and it will be benefit every member. And one of the ways we can do it is by registering. Registration is open in the portal. The message will also be said, either you visit the website or you follow the link. It's a simple 2 or 3 step registration so that data can be captured. Data is important for so many things. Data is even money. It also helps us for when we want to do programs like even elections, so people don't jump in and say they are members. So it's important to identify now and pay a token of 5,000 naira so that you can be. So we are hoping that after this program, a lot more people we had over 100 and something people that attended should be able to register and identify with HCPAN Lagos, so we can have our data up and doing. So that's how we come to an end of the program. We look forward to more interesting programs in future, and also thank everyone for being part of it. Thank you very much.
Hello.
The chairman, yes, go ahead.
Yes, I just want to make a comment before we round up, eventually, before the secretary come up to take the, that's in 2 people in our midst. One person, it appears he would like to say 1 or 2 things. But before I call him, let me appreciate acknowledge the presence of Madam Catherine Tazamando. She's the Deputy General Manager of NHIA Lagos Zone, and she might be our speaker for next webinar. So, Madam, can you say hi to us if we are still on the call? Madam Catherine, are you still with us?
Yes, I'm here. I can hear. Good afternoon, everyone.
Okay, good afternoon. You are welcome. We appreciate your presence.
Thank you, ma'am.
Okay. Yeah. And secondly, I think you also want to make 1 or 2 comments, Professor Ibekwe. Sir, you can unmute and make your comment. Your presence at our meeting today is highly recognized and appreciated. So you can please unmute, introduce yourself, and then make your comments, sir. Yeah.
I think he has left.
Okay, I think he was raising his hand at a time. We'll try to reach out to him. He might have, it's not every time Professor join us on calls like this, so he might have some information for us. We'll try to reach out to him. So with that, I think I'll hand over to the secretary. Moderator, any other thing?
No, there's nothing except the secretary will just come up to give us a vote of thanks. Thank you all. Dr. Olawale, Dr. Oladubu, Wale Oladubu, please, we recognize your presence too. You are welcome.
Thank you very much. Dr. Oladubu, part of the current ESCO at the national level. You are welcome. So over to you, Secretary, Madam Okwashi.
I think Prof. Ibekwe is available now.
Okay.
Yes.
Okay, Professor Ibekwe. Please, over to you, sir. You are welcome. Please
Okay, yes.
introduce yourself and then make your
Yeah,
comments, sir. Yeah.
yeah, I'm Professor Christian Ibekwe, Po Clinics, Lagos. The session was okay. I think the main thing takeaway is that the healthcare sector is due for constant reform, and that will benefit the patients. So I really appreciate the step you're taking. The webinars, as they come, the pharmacists, even the other healthcare professionals, will be getting better and better. And at the end of the day, the patients are there for the good thing. So I encourage it. And I also want to emphasize again that it's a win-win situation for everybody. That's what I'm trying to say. Why the regulators, Lashma is winning, the pharmacists are also winning, and the patients are also winning. So we should continue the efforts, and it's highly recommended. Thank you very much.
Thank you. Over.
Thank you, sir. Thanks for your comments. And I also want to acknowledge somebody that is all the way from one of the states outside Lagos. You are appreciated, sir. Thanks for joining us. Thanks for joining the webinar. Yeah. Over to you, Secretary.
Yes, ma'am. A very good afternoon to all. I am Ms. Okwesh Teresa, and on behalf of ACPAN Executive Council and the entire ACPAN Lagos State, first of all, extend my most sincere thanks to the Almighty God for making this event a resounding success. By His grace, we were able to make this event, and it was a huge success. I extend my profound vote of thanks to our esteemed guests, Dr. Funke Igimaki, the quality assurance consultant, Lashma, for making our time from a busy, there is noise, the noise is so much. For making our time from our busiest schedule to grace this webinar with her professionalism and expertise on the theme, quality framework towards achieving universal health coverage. We appreciate you for the points you made and the questions you answered. Looking forward to hearing you speak again, ma'am. My heartfelt gratitude goes to all the past and present ACPAN state and national executives, Dr. Aribabu, Dr. Aipo, Akintade, and others. Big thanks for gracing this webinar. I will not overlook the presence of our great providers, ACPAN Lagos State members, at this webinar today. This event wouldn't have succeeded without you. We hope you have learned and enjoyed these presentations. We are indebted to you all. Of course, behind the success of this great webinar is a formidable force. ACPAN Executive Committee, most especially the state chairman, Pharmacy Mrs. Abiola Poluze, and the publicity secretary, Pharmacy Mrs. Alada Sini, for making this event happen so beautifully. I hope we continue to work together and organize such events in the future for the betterment and upliftment of our association and members. I am immensely thankful to everyone present here today. And our sponsor, New Heights Pharma, thanks so much for all you've done today, for making this webinar possible. Thanks to one and all. God bless you all.
And I also want to thank the secretary for the work she's doing in HCPAN Lagos, ESCO and HCPAN Lagos. Thank you, madam, for filling your post quite well. We really appreciate everybody. God bless you.
Thank you, ma'am. Thank you. Bye-bye.